Good evening, audience. I'm Dr. Raymond. I'm the ENT doctor in Beacon Hospital, and I'm going to demonstrate to you how we perform a head and neck and ear, nose and throat examination of the patient. Okay, first of all, we're going to observe the patient. I've just loosened his button here just now. So we're going to loosen and have a good view of the neck, look view of his nose and his ears. Okay, you want to start by looking whether there are any obvious swellings in the neck. The skin looks normal, there's no discoloration of the skin, there's no obvious. We ask the patient to swallow saliva. Mr. Amri, please swallow saliva. And we observe the movement of the neck here in the front of the neck. If there's a swelling of the thyroid, what is known as an enlarged thyroid, what is known as a goiter, then we can see the thyroid moving up and down. But we don't see that, so that everything looks normal here. Then we will then look at the ears, all right? Look at the ears. Okay. And we look at the nose, all right? Look at the ears on this side. Okay. We will also want to do a airway patency and airway opening examination. This is a simple test called the Trotter's test. What we do is we press the nose, breathe in, Mr. Amri, and they listen to that airflow. And this side, breathe in. One more time, breathe in. Okay, it looks quite normal, it's quite equal, but that's a good sign, all right? And then we want to start, we want to proceed by feeling the neck for any abnormal swellings, all right? We start by feeling under the chin, going back, all right? Feeling the upper 1/3 of the neck, the lower 1/3, the middle and the lower 1/3. Go back and feel the back of the neck, all right? And we end by feeling the areas above the collarbones. What this is known as the supraclavicular fossa, all right? Make sure there's no swellings. Normally, if there is a swelling of the neck, then we have to do further investigation, all right? We will then proceed to do an examination of the mouth for the patient. So ask the patient to open the mouth, stay calm. Mr. Amri, give me a good ah. Ah. Well done. Ah. Lift your tongue up. Look under the tongue. Look under the tongue. Look at the side of the cheeks. Look at the back of the throat. Look at the tonsils. Look at the palate, the soft palate, the hard palate. Also must look right at it, back angle. Little recess behind the tongue, and sometimes there are hidden lesions in that area, all right? So everything looks good with Mr. Amri. The next step of our examination would be to use the cameras, okay, to look further inside into the ear, nose and throat areas, and that's in part 2 of this video. Thank you. Welcome to part 2 of this ENT examination video. In this part 2 section, we'll demonstrate to you all the use of our endoscopes in ear, nose and throat examination. This is our patient, Mr. Amri. We're going to start by looking at Mr. Amri's ears. Okay, we always want to start with the drier areas of the ear, nose and throat before we proceed to the wetter areas. But before we do the ear examination, I'm going to put a little spray into Mr. Amri's nose to prepare his nose. This spray actually helps to decongest the nose and makes it less tight when the camera goes in. So put a little spray, Mr. Amri. Thank you. Well done. Breathe in. Wipe the nose. You can hold on to that tissue in case it drips out. So we're going to start by using this rigid straight scope. This scope is a good scope when it comes to looking at the nose, looking at the mouth, and also it gives a very good view of what's happening in the ear canal and looking at the eardrum. All right, so here we go. We're going to start by looking at Mr. Amri's ear. This is Mr. Amri's right ear. Go into the ear canal. This is the ear canal, and at the end of the ear canal, you can see what is like a pearly colored membrane, and that's the eardrum. All right. Above the eardrum, you can see the first bone of the middle ear. That's the bone called the malleus. So this, behind the malleus, you have another two bones, the incus and the stapes. These three bones, they are called the ossicles of the middle ear, and they are also known as the smallest bones in the human body. All right. You then proceed to having a look at Mr. Amri's mouth. So we go into the mouth. Yeah. You look at his cheeks, the buccal cheeks. Look at his tongue. Go under the tongue. Look behind the tongue, right at this little corner known as the posterior. Okay. Areas of the tongue and the base of mouth, the bottom of the mouth, and this is the retromolar trigon. This area. Look at both retromolar. Look at his palate, a hard palate and a soft palate. I can see that. Yeah. Okay. Yeah. Good. Okay, we have look at his tonsils. Say Mr. Amri. His right tonsil. Say Mr. Amri's left tonsil. Yeah, they look alright. They look good. They're not inflamed. And look at the flora of Mr. Amri's mouth. Okay. And look at his gums. Go up. And look at his upper gums. Yeah. Well done, Mr. Amri. Okay, well done. And we will then proceed to looking at Mr. Amri's nose. So Mr. Amri, use your mouth to breathe. Go into his nose. So this is the right nose. So this is the side wall. What we see head on now is the turbinate of the nose. So this is, or what I like to call the sausage of the nose. All right. And the middle bone here is known as the nasal septum. All right. So we follow the floor of the nose, and we can see that the nasal turbinate, the sausage of the nose, is quite a long structure, isn't it? It goes all the way in. So we'll slowly go in here, and then we reach the back of the nose. Okay. You can see that Mr. Amri has got slightly enlarged adenoids. Okay, these are the tonsils of the nose. So you can see this little tissue here. And it's probably it could be due to nasal allergies, all right, which cause the enlargement of these adenoids, the tonsil of the nose. Here we have the opening of the eustachian tube opening. This little hole here that goes into the eustachian tube, and which connects the nose to the middle ear. It has an important function in equalizing the pressures, the air pressure between the nose and the middle ear. This little corner here in the upper right corner, and that little crevice there, that is known as the fossa of Rosenmuller, and this is the important area where nose cancers arise from. It always starts from this little area. It comes out from this corner, and then it shows up here. Fortunately, Mr. Amri has got a clear right fossa of Rosenmuller. We will then proceed to looking at Mr. Amri's left nose. So again, we go here, follow the floor of the nose, just under the sausage of the nose here, the turbinate of the nose, the inferior turbinate. Gently go all the way behind. Mr. Amri, you alright? Yeah, you're doing very well. And then we can see the left fossa of Rosenmuller, also that little crevice in the upper left corner. It looks clear, alright? You can also examine the middle meatus to look for any polyps, any signs of any infection. I see everything looks clear. And look at the right middle meatus. All right. Again, looks beautiful. Okay, there's no evidence of any infection. Sometimes you can see polyps, so you can see pus tracking down out from this opening there. The sinus openings, they open up in the middle meatus area. Thank you, Mr. Amri. You did very well. I can tell the viewers that in Mr. Amri, we saw a bit of redness in the right ear canal, and Mr. Amri tells me also that he uses the cotton buds to dig his ears, and sometimes that's not a good idea because we cause some scratches and some abrasions to the skin of the ear canal. So we advise our patients never to use cotton buds. We also saw in Mr. Amri, we saw some enlarged adenoids, the tonsils of the nose, and I suspect that Mr. Amri also tells me just now that he suffers from nasal allergies, and nasal allergies, they can cause enlargement of the adenoids. We were also very happy to see that Mr. Amri did not have any tumors in the nose or in the nasal cavities. Okay, so he didn't have any nasal pharyngeal carcinoma. So that is one of the top 5 most common cancers in Malaysia, NPC. Examination of Mr. Amri's mouth, I think, didn't reveal any abnormalities. His tonsils were not very enlarged. They were symmetrical. They were similar in size and shape, all right. And the examination of his mouth or his tongue, the areas in the cheeks and the palate and the base of tongue, the behind the bottom of the tongue, they all look normal. We will do a final video where we will do a fiber optic examination of his Mr. Amri's vocal cords and his swallowing areas. Thank you. Here we have the fiber optic flexible scope that we use in ENT examinations of the throat of the patient. So with this scope, we can go to look at the areas called the larynx and the pharynx. The larynx is the voice box of the patient. The pharynx would be the area just behind the voice box. And that is the area that takes part in the swallowing process. Okay, this is a nice little flexible camera, and we can move it up and down like this, so we can maneuver it into the throat of the patient. We always enter the nose of the patient first, and then we go down behind the nose into the throat. We don't want to go into the mouth directly, because then the patient will start to gag and start to tend to vomit. So when we go down the nose, it's so much more pleasant for the patient and not so uncomfortable. Mr. Amri, use your mouth to breathe. We always ask the patient to breathe in and out through the mouth so that the hot air of the process of breathing doesn't fog up the camera. So Mr. Amri, use your mouth to breathe. Thank you. We're going through the right nose. Go behind the nose, and this camera then can bend down, can flex down into the throat. So now we can start to see the tongue, the back of the tongue of the patient. All right. And this is the epiglottis. It's a little flap that closes the windpipe, the air passage when we eat and drink, so that food and water doesn't enter into the windpipe. Okay, we can start to see now that V-shaped structure would be the vocal cords. Say E, Mr. Amri.
E.
You can see the right and the left, both vocal cords of Mr. Amri is moving. They're moving very well. They're moving symmetrically, and that's a good sign. We do not see any unusual tumors in the back of the tongue. We don't see any unusual tumors in the right and left aspects of the pharynx. So when food and water enters into the right and the left side passages, just here and here, okay? So when we eat and drink, this area here, the airway, beyond the vocal cords, we have the trachea, and beyond the trachea, it leads into the lungs. So this windpipe closes this area completely. So food enters through the the left, and also comes on top of the epiglottis into the back there, what is known as the postcricoid area, the upper opening of the esophagus. The esophagus is a 10-inch muscular tube, 10 inches long muscular tube that connects the throat with the stomach. All right. So we're going to slowly come out now. Here we go. You're doing very well, Mr. Amri. In conclusion, this is the flexible scope examination of the larynx, the voice box, and the pharynx, the swallowing areas of the throat of a patient. It is quite a straightforward procedure. It's using a soft camera, a soft bendy camera, and the process is not very uncomfortable. We were happy to say that in this examination, the voice box looked normal, the pharynx, the swallowing areas look normal, and the back of the tongue, the epiglottis, the little flap that closes the larynx when we eat and drink. Both vocal cords also were mobile. They were symmetrical. They looked the same. They didn't have any unusual lesions. There was no growths in the areas of the pharynx of the throat, and this is what we would expect in a normal examination of a patient who has undergone a flexible scope examination of the throat.